MindForge presents causes and symptoms of narcissistic personality disorder. Narcissistic personality disorder is a mental health condition in which people have an unreasonably high sense of their own importance. They need and seek too much attention and want people to admire them. People with this disorder may lack the ability to understand or care about the feelings of others. But behind this mask of extreme confidence, they are not sure of their self-worth and are easily upset by the slightest criticism. A narcissistic personality disorder causes problems in many areas of life, such as relationships, work, school, or financial matters. People with narcissistic personality disorder may be generally unhappy and disappointed when they're not given the special favors or admiration that they believe they deserve. They may find their relationships troubled and unfulfilling, and other people may not enjoy being around them. Treatment for narcissistic personality disorder centers around talk therapy, also called psychotherapy. Narcissistic personality disorder affects more males than females, and it often begins in the teens or early adulthood. Some children may show traits of narcissism, but this is often typical for their age and doesn't mean they'll go on to develop narcissistic personality disorder. The causes of narcissistic personality disorder, NPD, are complex and can be influenced by a combination of genetic, environmental, and psychological factors. While the exact cause is not fully understood, here are some potential contributing factors. Number 1. Genetic and biological factors. There may be a genetic predisposition to developing NPD. Research suggests that certain genetic variations and neurobiological factors could play a role in the development of narcissistic traits. Number 2. Environmental factors. Childhood experiences and upbringing can significantly impact the development of NPD. Children who receive excessive praise or are excessively indulged by their parents or caregivers without appropriate boundaries may develop an inflated sense of self-importance and entitlement. Conversely, individuals who have experienced neglect, abuse, or inconsistent parenting may develop NPD as a defense mechanism to protect their fragile self-esteem. Number 3. Psychological factors. Certain psychological factors can contribute to the development of NPD. For example, individuals with low self-esteem or feelings of inadequacy may use narcissistic defenses to mask their underlying insecurities. Additionally, a person's temperament, such as being highly sensitive to criticism or having a need for admiration, can increase the likelihood of developing NPD. Here are some symptoms of narcissistic personality disorder and how severe they can vary. People with the disorder can: first, have an unreasonably high sense of self-importance and require constant, excessive admiration. Second, feel that they deserve privileges and special treatment. Third, expect to be recognized as superior even without achievements. Fourth, make achievements and talents seem bigger than they are. Fifth, be preoccupied with fantasies about success, power, brilliance, beauty, or the perfect mate. Sixth, believe they are superior to others and can only spend time with or be understood by equally special people. Seventh, be critical of and look down on people they feel are not important. Eighth, expect special favors and expect other people to do what they want without questioning them. Ninth, take advantage of others to get what they want. 10th, have an inability or unwillingness to recognize the needs and feelings of others. 11th, be envious of others and believe others envy them. 12th, behave in an arrogant way, brag a lot, and come across as conceited. At the same time, people with narcissistic personality disorder have trouble handling anything they view as criticism. They can become impatient or angry when they don't receive special recognition or treatment, have difficulty managing their emotions and behavior, feel depressed and moody because they fall short of perfection, have secret feelings of insecurity, shame, humiliation, and fear of being exposed as a failure. People with narcissistic personality disorder may not want to think that anything could be wrong, so they usually don't seek treatment. If they do seek treatment, it's more likely to be for symptoms of depression, drug or alcohol misuse, or another mental health problem. What they view as insults to self-esteem may make it difficult to accept and follow through with treatment. If you recognize aspects of your personality that are common to narcissistic personality disorder, or you're feeling overwhelmed by sadness, consider reaching out to a trusted healthcare provider or mental health provider. Getting the right treatment can help make your life more rewarding and enjoyable. It's important to note that not everyone with narcissistic traits develops a full-blown narcissistic personality disorder. NPD is diagnosed when these traits significantly impair a person's functioning and relationships, causing distress to themselves and others. It is also worth mentioning that a comprehensive diagnosis of NPD requires a professional evaluation by a qualified mental health professional, such as a psychologist or psychiatrist, who can assess the individual's symptoms, history, and overall psychological functioning. If you enjoy the content of this video, like, comment, and share. For more videos like this, don't forget to subscribe our channel.